Welcome to Stem Cell Activators with Dr. Joseph Christiano. Dr. Joe is a naturopathic doctor with over 45 years of experience in natural health. Each show is about one of our 27 different stem cell activators, and today's show will be focusing on the activator for blood sugar. Listen and discover how stem cell activators are helping people enjoy a greater quality of life.
Hi, I'm Dr. Joe Christiano, and welcome to my show. I'm so glad you tuned in. You know, today we're going to delve into the stem cell activators. A little different than other shows because we're going to do a little Q&A, some questions and answers to help you understand a little bit more about how to use them, how they work, and so forth with the condition you may be dealing with. Later in the show, my wife Lori is going to join me, and we're going to do that portion of the show, Stem Cell Revolution, which is all about different testimonials, and in this case we're going to delve into the pancreas. We're going to talk all about that, related conditions and so forth, which is going to be very informative. But before we get there, I want you to be able to get a hold of me. So call my home office, 1-800-259-2639. That's 1-800-259-2639, and speak to one of my body redesigning angels. I promise they'll take really good care of you. Or go to my website at bodyredesigning.com, and when you check in, remember we have 27 different stem cell activators to help you with your health. Now, I want to give you a little more of an education on the stem cell activators. But like in many events in our life, there are things that promoted or really energized us to get started. And besides my own research and my own personal interest in finding remedies that were natural, remedies that were, cutting edge, something that maybe nobody's heard of yet, to help me with my personal conditions, with my health, particularly chronic pain, there was one person that really motivated me to take this to television and to put it in my book, Stem Cell Revolution. And that's my mother. I could talk all day about my mom. But anyway, at 90 years old, my mother had been a diabetic for 18 years. And during that course of time, she started to experience, like many people that are diabetics eventually do, and that's failing kidneys. And so she got to the point where her kidneys were down to 25% and less function. And at that time, the doctor was encouraging her to talk to her family and to get us prepared and her prepared for going on dialysis. Now, needless to say, she was just scared to death. And she told me this, and I reassured her. I said, Mom, I am not going to allow you to go on dialysis, particularly at 90 years old. And so I had already started working with the stem cell activators on myself, and I was having great results, and a couple other people, but in a very small circle. So I told her, I says, listen, I got her a stem cell activator for her kidneys and a stem cell activator for her pancreas. One to take care, of course, the kidney, and the other for her blood sugar, her diabetes. And by the way, these are not stem cells. These are stem cell activators, which activate your stem cells. When they activate your stem cells, then that phenomena occurs, and your stem cells that aren't functioning properly would begin to function properly, and that is healing the body. So here she is 18 years down the road dealing with diabetes and now failing kidneys. And so religiously, she started taking her 20 drops a day in 2 ounces of water on an empty stomach. She did it day in and day out. And in about 3 to 4 months, she went back to her physicians, and they did blood work and to see where she was, not knowing anything about being on stem cell activators. And the doctor that was treating her for her kidneys sat her down, and he goes, Helen, I don't know what's going on, but your kidneys are actually improving. Now imagine this, a 90-year-old, kidneys are improving in 2, 3, 4 months of taking these drops, stem cell activators. Needless to say, she was elated, and more so because he told her that we can forego the idea of going on dialysis. Now, my mother was almost in tears. I was almost in tears because of the joy I was feeling for her. And then her doctor that was treating her for her sugar had to drop her insulin by 50%. 50%. And I thought to myself, if a 90-year-old can get results like that, what about a 70 or a 60 or a 50-year-old? And so that really prompted me to really delve into this and to take it to television, take it to radio, take it to everybody, to let them know, listen, there is hope. There is something different than something natural that's different than taking medications. Because you and I know the best you're going to get out of medication is managing your symptoms. Well, my mother was on medication. She was taking insulin and all these things, but at 90 years old. And so now with the option in education, that's why I want to do this show for you, is to give you a little more education on how these stem cells or the stem cell activators work with stem cells. It'll make a lot of sense to you. But the results I'm seeing, and in my mother's case, that was a near miraculous response. Her body responded to that favorably. But my mom's gone now. She passed away. But the last 2 years of her life, at 90, 91, my mother would wash her own car. She would mow her lawn. She was just a pistol. My mother was just something. But more than that, she used to have her own workout program. Now, mind you, I'd go to her house and she'd have her pulley mechanism set up on the door in her house. And she'd say, watch, Joey, this is, and she'd start pulling her pulleys, and she's doing the curls and all these things. She also had exercises she did in bed. She'd lift her leg. She showed me everything she'd do. And so that's the type of mother I had. But she ended up having a fall. She injured she had dementia. She was starting to lose her mind, and she really started to deteriorate. And while she was in the hospital, the last 5 days, the internist who was monitoring her vitals, at that stage of the game, they're just declining, everything's dropping, and then they pass. And I would check with him every 24 hours to see what the new labs showed. And after about 3 days, he said to me, he goes, I've never seen this in my entire career. When the vitals are shutting down in a person that's about to pass, your mom's kidneys were improving. Well, he didn't get it. I didn't tell him. But the eternal optimist, which I am, I was giving my mother stem cell activator drops in her bed in the hospital without anybody knowing it, 2 to 3 times a day. And they were activating her stem cells, even in those last days of her life. And so what that proved to me was this is way beyond placebo. Placebo, some people take, you tell them take the sugar pill and all of a sudden their ailment is gone. It's here, it's mental. But the mental part of all this here, when it comes to our health, is the attitude, the positive attitude in doing the things you ought to be doing for your health, besides taking stem cell activators. In other words, a healthy lifestyle. And I'm going to have a show on that one day about healthy lifestyle practices, because we've got to strengthen our body. We have to build our immune system to fight off viruses and bacteria and fungus and things like that. So we'll get into all that stuff. But that really proved to me that these stem cell activators are way beyond placebo effects. And so hopefully you'll get something out of today's show. Before we get into the Q&A, I'd like you to call my office, 1-800-259-2639, 1-800-259-2639, and speak to one of my body redesigning angels. I promise they'll take really good care of you. Or go to my website, bodyredesigning.com, bodyredesigning.com. And when you check in, remember we have 27 different stem cell activators to help you with your health. Let me get into this right now. I get these random questions. So let me look at this list here, and I'll start picking them apart. I don't know how much time I have, but let me start, and we'll take a look at this here. Here's a question, I guess, that they get in the office all the time. How long do I have to take these? How long do I have to take these? Isn't that something? How long have you been on your blood pressure medicine? How long have you been on Lipitor? How long have you been taking your meds, right? It's a legitimate question. And the answer to that is you tell me how long. And what I mean by that is I have people that are taking the stem cell activators, and in 3 weeks, they notice a tremendous difference. I have other people taking activators, they don't notice anything for 4 months. And see, it's an individual thing. It has to do with your physiology, the condition of your health, and so on and so forth. But once you get to the point, and this is what I tell everybody, listen, If you have a condition, get the blood work and find out where you're at so that we can monitor your progress. And then once you start taking the activators, maybe for 90 days, go back and get some more blood work, get your labs in and see the progress. And then you can determine from there if you still need them or if you don't. Let's face it, some patients that we have, they might have glaucoma and their the pressure in the eyes are extremely high. That comes down to the normal range. They don't need to take them anymore. My mother, she got her kidneys improving, and I says, Ma, you probably don't have to take them anymore. She goes, why stop a good thing? You know, so it's up to the individual. So there is no time, but you don't have to stay them on the rest of your life unless that's your choice. It all depends on how your body responds. Are there any age restrictions to this? No, there's no age restrictions. In other words, my mother at 90 could take them, but so can your granddaughter or your daughter or your son that's an infant, or because there are absolutely no side effects. These are not medications. These are not embryonic stem cells. They're not stem cells. These are activators, and they're plant-based. In other words, in the studies that the scientists had done with this over 30 years ago, they determined that certain plants with their peptides or amino acids have a particular ability to affect or target areas in the body. That's why we have 27 different activators, so that you and I can treat 27 different areas if that's what we're dealing with. And so these are natural. There's no side effects. You can stay on your medications. You can take your nutritional supplements, and there's no interference. The key to know is that these activate your stem cells. Now, let's face it, you're learning a little bit. I thought I'm running out of time. I could tell you so much more. But you learn a little about stem cell activation, but what about stem cells? What do you know about that? And let me break that down real quickly for you before we get into that segment. At birth, you and I were given stem cells. It's part of our genetic makeup. And I'm not talking about embryonic, I'm talking about adult stem cells. And these little guys, and there's millions upon millions in the body, when something happens, something occurs, an event, a trauma, you fall off your tricycle when you're little, you get in a car accident, sports injury, whatever it is, whatever that trauma is to the body, these stem cells are released in the body, and they become the damaged tissue or cells that, or I should say the cells or tissues that were damaged. So in other words, if you broke a bone, they become osteocytes. If it's nerve damage, they become neurons, and so on and so forth. And that's how the body works. But over time, age-related pollutants, environmental pollutants, traumas to the body, and so on and so forth, these stem cells, your stem cells, my stem cells, start losing their capacity to heal and repair. And so what happens? You and I have this nagging, ongoing condition. And so what do we do when we have that, or chronic? We go to the doctor, and the doctor, after doing an examination and hearing our symptoms, our complaints, gives us scripts for medications. But you know and I know they're only going to treat the symptom, not the root cause. So by taking the stem cell activator that is appropriate for your condition or conditions, they activate and rejuvenate the stem cells that are not functioning any longer. In other words, they function from the standpoint of, it's called cellular signaling or cellular communication. And what they do is they tell each other what to do, what tissue to address, and they start the healing process. Now, some people in 3 weeks are getting results, some people 3 months. And the reason is because the activation is occurring, but their rejuvenation is taking some time. Okay, and hopefully to get them at an optimal level so that their stem cells can start healing the body. And so it's all natural, it's genetic, and that's what our God-given mechanisms are. We're just learning that now in the real world. So hopefully you can take this information when it comes to something, some condition or illness, something, you have this in your arsenal. Anyway, let's delve in and listen to what Lori and I have to tell you about the pancreas and all about the activator for it. Hi, I'm Dr. Joe Christiano, and with me is my sidekick and wife, Lori.
Hi.
Listen, we are here to share with you some really good information about our stem cell activators, and in this case, it has to do with the pancreas. And we know the pancreas has a direct effect on sugar control, insulin response, glycogen and glucogen, and so forth. But we're going to talk about some topics like diabetes and things that are very common, but yet they shouldn't be a part of our physiology today. We have so many people that call us, Lori, and you probably know this better than I, who are dealing with diabetes, their A1C levels and things like that, and how to monitor them, but they're not getting relief. That's the thing that is real puzzling, not just in my mind, but for a typical patient, because across the board, when we have an ailment or a condition or a disease, we're dealing with conventional medicine. And the conventional medicine approach to a condition is to focus primarily on the symptoms. If you have a pain, you take something for the pain. If you have a swelling, we're going to reduce the swelling. But the root cause is really should be the focus point. That's what we should be targeting.
Yes.
And so the activators that we're talking about today, the pancreas is really the one that we're finding some really wonderful results.
I would like to kind of tell you about the possible applications for this particular activator. This is called PANC for pancreas, and it's for anybody who has diabetes or blood sugar issues. We have a lot of people who call in and say, my blood sugar is crazy, but I don't want to go on any medications, or I don't want to go on any insulin.
What's good too is when you do take the activators, they don't interact with the medication. There's really no limitation when it comes to that.
I'm going to read the possible applications of who should be on the pancreas stem cell activator. It's PANC for pancreas. It helps regulate intracellular communication and supports cellular and tissue regeneration of the pancreas. Supports body's natural ability to regulate blood sugar. Possible applications: pancreatitis, diabetes support, pancreatic insufficiency, degenerative and pathological conditions, etc. Even people with pancreatic cancer have taken these with one of our other activators that we recommend. But our office can always help suggest which ones would be good for whatever condition you've got. But it's been really amazing what all it can help with.
Sure. And another thing is, you read this, but the tissue, the pancreatic tissue gets damaged over time. And in many cases, our stem cells, those are our genetic material that's given to us at birth, which are our body's natural cellular tissue healing mechanisms, okay? So if you have a trauma, if you have some physical damage to your body, or if you have even like a degenerative illness like diabetes or any kind of degenerative illness, the stem cells rush into that particular system or organ, and it's called differentiation, and they become those cells, and they can heal those cells. But over time, the aging process, our stem cells are not functioning up to par. In fact, they have an inability to signal to one another, which causes your tissue, in this case, the pancreatic tissue, to be damaged. And so you have a litany of these symptoms, and now we start addressing the symptoms. But Lori's going to share some testimonials about people who, once they took the activator, the pancreas activator, they started to see the symptoms or some of the symptoms dissipate, and that's the goal, because even if it takes months for you to get out of the woods, so to speak, if you're moving towards healing, if you're moving towards repair, you're heading in the right direction. Because if you're not, then you're heading for destruction through the degeneration process. We either take care of ourselves or we start to degenerate. And this is very, very cutting edge technology, and it goes to the root cause, rejuvenates your stem cells, so the stem cells can go, in this case, work on the damaged tissue in the pancreas, and hopefully get that pancreas back to normal function.
A lot of times people want to know how long it takes before it starts to activate. We tell everybody, we don't know. It takes time. We say give it at least 3 months to 6 months. But the key is to watch your A1C numbers. Sure. If you're going back to your doctor and you get your numbers checked, that's where you're going to find out how you're doing. And we always say at least give it 90 days.
Yeah. Well, Lori, if they would monitor, that's the best way to prove it. You can hear what we're saying here and educate you on how they function and the reports that we get back from people that are taking them. But I think where the rubber meets the pavement, or the acid test, is in this case, you can go have your A1Cs tested. And so if you started off, if you have an issue with your pancreas, or maybe you're diabetic, you may have your A1C number now. If not, I would recommend you go get a number.
Yes.
And you start at that point with the activator. Then you can have a periodic retest, and see and compare the numbers.
Yes.
And if you're moving in the right direction, which hopefully you would be, then you're on the right track to recovery. Hey, Laura, let me take a minute to let the people know how to get a hold of us. Call our home office at 1-800-259-2639. That's 1-800-259-2639. And you're going to talk to one of my body redesigning angels. I tell you what, they will take very good care of you. Or you can go to the website, bodyredesigning.com, bodyredesigning.com. And when you check in, remember we have 27 different stem cell activators to help you with your health.
And I had actually a lady, she called in the other day, I think it was last week, and she was saying that she's been on the activators for 4 bottles. And when she started, her blood sugar number was in the 200s.
Wow.
After the first bottle, she checked it, and it was at 170.
Okay. Wow, that's a good
Second bottle, she checked it, it was at 150.
Let me interject this. When Lori's saying 4 bottles, and after 1 bottle, and after the next bottle, we're talking about possibly a month or less. Because the bottle, if you're taking 20 drops a day, what are you going to get? Maybe
25 days.
25 days. So almost less than a month, her numbers went from 200 to 170. I mean, come on. They weren't moving before, but in the wrong direction.
No. Nothing was working for her. She just was so miserable. Then she went down to 150. And then when she called to reorder some of the products, she called and said, my number's been at 130.
Wow.
And she's so excited because it's almost like every bottle she was experiencing a 20-point drop. And she was so excited. She's telling everybody all around her to get on these activators because they're easy to take.
But also, it's not medication. That's the wild thing. Like Lori said, these are plant-based, okay? And the specific plants have a frequency that addresses one or all the organs in our body. And so that's how these are basically formulated in a nutshell. But if you're seeing these numbers drop down, if in this case, this woman, she's at 200, she's not doing anything different, nothing different except for taking the activator. And all of a sudden she's seen an improvement in her readings. That means her pancreas is working better. So there's a healing process going on. Now I want to just say this here, Lori, before you read some testimonials. The activators do not heal. The activators do not repair. The activators activate and rejuvenate your stem cells. And once they're back up to par in their function, and that is cellular communication, then they do their job, and that is to repair tissue. So obviously, if you have an organ that's dysfunctional, you're going to have symptoms, and the medical community can test you for a symptom. In this case, she starts taking the activator for her pancreas, and the numbers start to decline. And that's the direction you want to go if you want to improve. And so the healing effect is taking place because her stem cells are being reactivated.
And we get, it's such a common problem is diabetes.
Very common.
And it's sad that how many people have to deal with insulin and I get people who say, I'm so tired of poking myself. I'm so sick of it. I just don't even want to do it anymore. And we're always saying, no, don't stop what you're doing. Start taking what we have here and then go back to your doctor and let them adjust your medications because the pancreas is so important. It affects so much in the body. So we get people with neuropathy pain who can't see. Their vision is being affected. Their kidneys are being shut down. They're going to go on dialysis. And we're like, do something easy.
You know, it's kind of like my mother, Mom. She had diabetes for 18 years. And so she too was having problems with kidney failure. But when she started the activator for her pancreas, I told her how to take them, 20 drops a day on an empty stomach, a little bit of 2 ounces of water. And religiously, she did that. And about 3 or 4 months down the road, she had another blood draw. And the doctor said, Helen, your numbers are improving. Let's drop your insulin by 50%. That's a 90-year-old woman.
I was going to say, she's 90.
Woman. Yeah. And so when that happened, this was in the early days of my discovery and research on these activators, I was so convinced that if a 90-year-old who's deteriorating, okay, I hate to say that, but as we get older, our body's deteriorating. And here's a 90-year-old recovering just like that. And I had to tell the world.
I know, it's exciting.
Yeah, very exciting.
And people ask us, well, I'm in my 80s, or they'll even say I'm in my 60s or 70s. I'm like, you're young. We have people in their 90s and 100s calling us.
You're not too old to heal.
No, your body can still help you. And we always tell people, don't give up on trying to do something good for your body. Don't stop, helping yourself. Don't expect your doctors to have all the answers. It's up to you to find more things that can help you, feel better.
And so when you take the activators, what you're actually doing is you're going to the very root cause. And the root cause is obviously causing all the symptoms. And we repeat ourselves, but that's the key. But if you're going to a caretaker or a healthcare provider who is only treating symptoms, you're not going to improve. There is no scientific documentation or medical proof that any medication will heal your body or heal a system or repair tissue. It only treats the symptoms. And so this technology, which is very cutting edge, and I'll guarantee you, if you go to your physician and say, I was thinking about taking stem cell activators, he or she probably never heard of them yet. This is something that is revolutionary. It's just like stem cell therapy, very revolutionary. Even though it's been around for a few decades now,
30 years.
We're finding now that the God-given genetics, the God-given genetic material that we have in our body, science and medicine is learning now, if we can extract our own tissue, in this case, we'll say stem cells, re-inject them into an area, a joint or something, it'll heal itself. In this case, we're talking about reactivating stem cells that are no longer functioning properly, which is causing us this, we'll say, chronic or nagging condition. And so through that, it's almost, in some cases, Lori, and it's not in every case, but in many cases, the reports we get is near miraculous.
I just had another lady, she was on just 2 bottles of the activators. And mind you, we really recommend people to give it at least 90 days, three months. But she was on it she was on 2 bottles, and she said her A1C number, which has been horrible. At the point, it was at 7.2%. 7.2.
7.2.
And then it went down to 5.8.
Beautiful.
2 months. And she says, I have never had it down to 5.8 in 16 years that she's been dealing with diabetes.
Listen, they're all natural, but they're extremely powerful. They are very powerful, but they're harmless. There's no side effects. They won't interfere with medications or supplements or anything like that. And that's why I'm such an advocate. When I recommend them to my mother, I'm going to recommend them to anybody, okay? Because I know it's not going to hurt her,
Yes.
But listen, feel free to go to our website or call our 800 number. The whole idea is to be more educated, more informed. And once you have this knowledge, once you have this information, now you know if it's you or a loved one or a friend that's struggling with an issue and they're contemplating, should I go to the doctor, should I have surgery, should I go on medication? Now you have some more information that is evidence-based that's helping people throughout the United States. So it's up to you to make that decision. So I would encourage you very much, if it should come to that you move in that direction.
Yes. If you would like to order our Stem Cell Activators or Dr. Christiano's book, Stem Cell Revolution, please call 1-800-259-2639 or go to our website at bodyredesigning.com. And while there, you can click on the TV radio tab for all our shows.